Hello, good afternoon. Deva sir?
Good afternoon, ma'am. Good afternoon, ma'am.
Yeah. Good afternoon, sir.
Good afternoon. Good afternoon.
So happy to welcome you on behalf of Department of Biochemistry, RGS College of Arts and Science. So shall we start the session?
Yeah.
Yeah. So it is day 3 of International Conference. So today we have as guest of honor Dr. Deva Ashwin, postdoctoral fellow from a national university in South Korea. So the topic he's going to address is from molecules to models, enabled interdisciplinary platform and medical applications. So over to you, Rohini. So we'll have a small introduction about Deva sir and we will start the session, sir. So do you want us play the PPT or what?
I have the PPT.
Okay, fine. You can do it, right?
Yeah, I can share the
present, right?
Yeah.
Okay. We welcome all the participants from different institutions. Welcome back. And we'll have a small introduction with Deva sir now. Department of Art.
Good afternoon, all of you. It's my immense pleasure to introduce our today's resource person, Dr. Deva Ashwin, sir. To start with his education, sir did his undergraduation from FDP Arts and Science College, his postgraduation from Bavaria University. Then he started his career as a quality control analyst in rabies, vaccine production, and human balance studies. Then he joined as a junior research fellow at SRM University of Science and Technology, Chennai, in the year 2018-20. Then Sir moved as a senior research fellow in the same institute. Apart from this, Sir has a good number of publications in national and international journals. After his SRF, he did his PhD and currently pursuing his postdoc fellowship at Gangsang National University, South Korea. We are very much delighted to have you as a resource person today, sir. Once again, we welcome you on behalf of Department of Biochemistry for this 7 days international FDP. Welcome you, sir. Welcome all of you. Thank you, sir. Thank you, ma'am. Over to you, sir.
Okay, thank you.
So the session is over to you, Deva. You can
Okay.
Thank you.
Good evening, everyone. Thank you very much for the opportunity to speak today. My name is Deva Ashirvadam. She already mentioned. I'm currently doing postdoctoral fellow in Gangsang University, South Korea. Today I'm going to talk about the interdisciplinary platform that connects biological system and biomedical application. This talk is focus on A is not a replacing tool. The A helps scientists to make better decision. So the first slide illustrates the multi-scale complexity of the biology. The biological systems, if we see, usually it's across many levels, from DNA to small molecules to proteins, tissues, organs, and entire population. As we move from left to the right, the biological complexity is increased dramatically. At the molecular level, we deal with the sequence and the structures. At the cellular level, we deal with interaction and spatial organizations. At the human population level, we deal with variability and real uncertainty. Here we can see there are large number of complexities from small molecules to human community population. So there is no single discipline can handle this much complexity alone. So for this only we are very much helpful in this today's generation. AI is a very essential in this analysis. Why we need to discuss this talk? First, we are experiencing large number of chemical and biological data. And imaging data. Example, if we go to PubChem, we can see millions of compounds. For small molecules, we have a database PubChem, ChemBMBL, Zinc libraries. There are millions of compounds. We have compounds, we don't have the results for those compounds. The same way for biological, we have a human genome project we have completed. For human genome project, we have the data for human genome project. But until now, we have experimentally characterized proteins. Numbers is very low. We know recently 2022 for AlphaFolds, machine language based AI tool that predicts protein structure. It got Nobel Prize in 2022. Over more than 3 billion structures were solved through AlphaFolds. And imaging data. If we take imaging data, if we go to any medical labs, we can they have MRI data, ECG scan data, every data we have. But what we have the data. What is the conclusion we can conclude with those data? There is a question mark. So all these data have patterns. To identify the patterns, human can't identify the patterns. Each and every image functions. There is a pattern. Machine can predict through mathematical, statistical, or physical based algorithms. Through that, we can predict those patterns, and then we can conclude. We can interpret the results. Second, the traditional single discipline research no longer sufficient to interpret the data effectively. Because we are now living in the world of AI era. People used to work. If example I'm telling, I'm working in biology experimental lab. Other lab will work in translation lab, other lab in computation lab, other lab will work in chemistry lab. The single lab will use one type of data. The data is already deposited in the website. We don't have integration between the labs to lab. So to integrate all those things, we have a effective approach. For that only currently we are using AI. The artificial intelligence acts between bridge between life science, medicine across all the fields to interpret the results and analyzing the pattern. Why we are always passionate about this? Yeah. In traditional times, we used to screen the drug molecules. From target validation compounds lead optimization to preclinical testing and clinical trials, the process of long and expensive process. Typically, it will take 12 to 18 years and billions of dollars to bring single drug to market. Each stage, many candidates fail due to toxicity or lack of efficacy. Here we can see there are a lot of phases. In all the phases, A can intervene and reduce the failure rates and improve the efficiency. That is the main role of A. Here we are using. And then what is the global market, global drug discovery market? If we look at the global current landscape, the global drug discovery market is growing rapidly. Is expected to reach 71 billion by 2025. However, we reach the growth, but the success rates remains very low. Even still now we are facing 90% of failure rates in clinical trials level 3. Interestingly, if we see only small number of companies and biotech companies using AI technologies. From using AI technologies, there are 150 drugs designed by AI are now in drug stages, and 15 are already in clinical trials. So we can increase the speed of the efficiency and then reduce the cost using AI. At this point, I want to just clarify one important reality. AI is just a tool. It's not a magical solution. It has a limited applicability if used incorrectly. If you want to master the AI, we need intensive training, domain knowledge, and continuous practice. Most important. Apart from any other things, most important, 90% of the success depends upon the quality of the data generating in the laboratory. The quantity of the data. When we are using low number of data, the algorithm will fail, and then proper preparation of the model is important. Poor data always leads to poor models. To enable interdisciplinary platform, we can see the Venn diagram. One is accelerated intelligence, analytical intelligence, augmented intelligence, automated intelligence. One is assistive intelligence. If we see accelerated intelligence, if we see automated intelligence, we can do all the things automation through robotic arms, and we can rapid the function, and then will reduce the cost of we can reduce the labor cost. If we see the left hand side, we can see the smartwatch, smart t-shirts, and then smart pants. These are the automated intelligence. These things have intelligence which is already predetermined and then incorporated into these devices, and then it will give the outputs. If example, the smartwatch, mostly all the people now we are using smartwatch. In the smartwatch, if we are seeing the heart rate, it has a capability to calculate the heart rate for each and every person. So it is automated intelligence. Already all the parameters were incorporated into the machine, and then it will calculate according to the person to person. And next assistive intelligence. Assistive intelligence means nothing but when we are doing easy task, we can do by ourselves. When we do the complex task, we'll require machines. Example, for small mathematical problems, we use calculator. If we ask 2 into 2, what is the answer? Easily say 4. But when we are calculating the huge numbers, that thing we cannot calculate. But what are the operation we need to give? Example, if I want to do addition, subtraction, multiplication, the operation which are defined by the researchers. The same way the assistive intelligence helps in drug discovery. we can do 1,000 to 100,000 to thousands of compounds through assessing intelligence. We can screen compounds. Even though we can screen compounds, the final result has made by the scientist. The person who's doing the experiment is going to make the final decision. That's called assessive intelligence. And accelerated intelligence is nothing but it accelerate the outcome of the results. If example we are going to doctor. If we consult the doctor, he can say we have fever, or we have to go for other diagnostics. If we have a severe complexion, we have to go for other examination to identify the disease. The same way, the accelerated intelligence will accelerate the efficiency. If example, we are doing clinical trials for 100 people. For the 100 people, we will do physical examination. The physical examination itself can know the a patient is getting better or not. So by seeing the patients visually. One second. So we have disease individuals and healthy individuals. When we treat both groups, we have patterns. So the disease group and healthy groups share same genes. If example, the oncogenes also present in the human cells when it